A 73-year-old man is brought to his physician by his son for progressive memory loss. The patient seems healthy on physical examination but reports that he has been having trouble remembering things his son tells him for some time now, and that he got lost at the grocery store when he went shopping yesterday. Laboratory tests are unremarkable. The physician prescribes medication to increase the concentration of a neurotransmitter. Which of the following is most likely this neurotransmitter? Choice A, dopamine. Choice B, norepinephrine. Choice C, acetylcholine. Choice D, glutamate. Or choice E, serotonin. I'll wait 5 seconds and answer the question. Patient has Alzheimer's, kind of obvious. In Alzheimer's, cholinergic neurons in the basal nucleus of Maynard degenerate. So first-line treatment is acetylcholine esterase inhibitors such as donepezil, rivastigmine, galantamine. Step 1 doesn't usually test on treatment for Alzheimer's that often, but I would at least keep donepezil in mind. And just be generally aware of the fact that when you're talking about memory and cognition, you want to be affecting acetylcholine levels in the brain. Choice C is the correct answer. So like I was saying, donepezil, you can just keep that in mind. But the other drugs here, rivastigmine, galantamine, I mean, just by listening to those names, if you're familiar with your autonomic pharmacology, some of you might be like, well, rivastigmine kind of sounds like physostigmine. Okay, well, what does physostigmine do? It's a cholinesterase inhibitor. Okay, what would a cholinesterase inhibitor do? It increases acetylcholine. Only difference is that when you hear about physostigmine, it's usually in the context of stuff like cholinergic poisoning of some kind, maybe myasthenia gravis. Now, of course, a long time back, we did try to use physostigmine as an Alzheimer's drug, because mechanistically you would assume it would, right? But clinical trials revealed that it really didn't have much effect. Anyway, bottom line here is that you want to know that when you're talking about memory cognition, you want to be thinking about the neurotransmitter acetylcholine. Okay, so let's look at the wrong answer choices here to talk about the other neurotransmitters. Choice A, dopamine. This is involved in movement and reward. Obviously, the first thing we think about is the nigrostriatal pathway. Very annoying pathway to learn details of, and I'm not going to go over it here because it's going to make this video way too long. Obviously, a deficiency in dopamine in this pathway, it can cause Parkinson's disease. That's the first thing you think of with dopamine. But of course, we also think about dopamine in regards to reward and addiction. And when we're talking about schizophrenia, we think about positive and negative symptoms, and positive symptoms come from problems in the mesolimbic pathway, whereas negative symptoms come from problems in the mesocortical pathway. And of course, just as a quick review, a positive symptom in schizophrenia is when you're hallucinating and you have disorganized thinking, agitation, that sort of thing. And negative symptoms are things like flat affect and anhedonia. One other thing that comes up once in a while is that dopamine is also involved in negative feedback for prolactin at the pituitary. So that's why when you give anti-psych meds to decrease the amount of dopamine in the patient's body, it will also decrease the negative feedback to prolactin and therefore increase prolactin, and that's why one of the side effects is galactorrhea. Anyway, choice B, norepinephrine. As far as norepinephrine goes as a neurotransmitter, you really just need to know it's involved in alertness and mood. I don't think anything other than that is that important. Off the top of my head, you would be more concerned about the effects norepinephrine has peripherally, right, at alpha and beta receptors. And of course, norepinephrine is alpha more than beta, whereas epinephrine is beta more than alpha. Choice D, glutamate. Glutamate is the main excitatory neurotransmitter. So in Alzheimer's, you actually might target glutamate once in a while because constant excitatory activation can damage your neurons. So you might give like an NMDA blocker or something. But whatever the case, that would be a reduction in glutamate amount or effect, right? So we're talking about an increase in a neurotransmitter here. So it's just not really a good answer choice. And of course, real quick, what's the main negative neurotransmitter that is opposed to glutamate? It's GABA, right? Choice E, serotonin. Serotonin is, of course, involved in mood regulation. You think about it when you think about major depressive disorder and those kind of things. Drugs, you would be thinking, of course, about SSRIs, SNRIs. So bring it back. I mean, once in a while, they'll ask about actual neurotransmitters. I mean, you just want to know that if you get a question about memory and cognition, acetylcholine is probably going to be what you want to be thinking about. With dopamine, it's movement for like Parkinson's disease and stuff, and glutamate, you'd be thinking about seizures because it's excitatory, and serotonin, you would mainly be thinking about mood. The questions come in very different forms, generally speaking anyway. I hope you found this video helpful. I'll see you in the next one.